All taste my best, Everest.
Myself, Dr. Dayanidhi Mayor, Professor and Head, Department of Endocrinology, KIMS Hospital. On the occasion of World Diabetes Day, I would like to send some message to the public for their benefit. World Diabetes Day is an important healthcare event celebrated on 14th November every year, and this year also we are going to celebrate this one. And the purpose of celebrating this World Diabetes Day is to create awareness among people regarding the surging prevalence of diabetes, its complications and management, and to give the preventive tips so that the patient will remain free of diabetes. What is diabetes? Diabetes is basically increased circulating blood sugar level in the blood. When it is persisted for a long period of time, causes a lot of complications, starting from acute complications like diabetic ketoacidosis and hyperosmolar coma to long-term complications like diabetic nephropathy, diabetic retinopathy and diabetic neuropathy, and hamper the patient's life to a great extent. Diabetes occurs because of the inability to process the food that we consume, mostly carbohydrate, which is the basic need for all individuals. So there is decreased assimilation of the glucose, which persists in the body, circulating in the blood, and causes maximal damage to most of the organs in the body. Diabetes can have symptoms like varied symptoms like increased urination, increased frequency of urination, nocturia, then weight loss, then fatigue, tingling and numbness of the extremities, delayed wound healing, recurrent genital tract infections. These are the signs, warning signs for development of diabetes. Basically, we will talk about the diabetes. There are three types. One is type 1 diabetes, where there is absolute insulin deficiency, and these people, they do need insulin for their survival. Then the common form of diabetes, which comprises almost 90% of diabetes, is type 2 diabetes, where the insulin secretory capacity of the body is decreased, and at the same time the insulin also does not act perfectly in the cell for glucose assimilation. And this type 2 diabetes prevalence is increasing day by day because of our bad lifestyle, sedentary lifestyle, and increased consumption of food or calorie. Third type of diabetes is gestational diabetes, that is also increasing prevalence because of the same obesity. That gestational diabetes develops during the pregnancy, and the most of the time outcome is good when the patients are treated properly. Then coming to the preventive strategy that I would like to tell, early part of diabetes can be reversed by proper dietary measures, healthy lifestyle, regular exercise and behavioral modification. Similarly, obesity is a significant contributor of developing diabetes, and we will achieve the ideal body weight. Then the glycemic management will be much smoother, and will provide organ protection for a long period of time. There are so many available options for the treatment of diabetes, like oral anti-diabetic drugs, injectable like insulin, and so many are in the pipeline also. But the most important thing is that prevention is the best strategy that can be done by avoiding the refined sugars and refined carbohydrates, avoiding the sweetened beverages, quitting smoking, regular exercise, that is aerobic exercise 30 minutes per day, at least 5 days a week, and in between the stretching exercises for 2 to 3 times a day. And healthy eating is also equally important. Rather, we should focus on fruits and vegetables rather than the processed food that is easily available and cheaper in the market. And regarding the prevalence of diabetes, worldwide 537 million people are suffering from diabetes, and the picture is rather more gloomy in India, where more than 10 crore people are suffering from diabetes among them, and that is translated into 11.1% population having diabetes. So 1 out of 11 Indians are having diabetes, and 15.3% are having pre-diabetes. They are likely to diabetes in future unless they modify their lifestyle and follow a proper behavioral pattern.
So इसको healthy tasty मीठी पान, बाइट में तूफान और मन बहल जाए। होठों से चूम के खाओ इसको, ला 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 लिख करो इसको।